Louise, I wonder if I can pick your brain. I'm really struggling with a trainee who's finding it difficult to accept feedback and to deal with feedback. Do you have any tips for me?
Well, to be honest, I'm finding the whole trainee feedback thing really difficult. I mean, when I give trainees individual feedback, I get accused of bullying. And then when I give them feedback in a very general way, sort of anonymously, I get accused of not taking the issue seriously and not addressing it in a private manner. So to be honest, I don't know what to do now. And I'm really thinking that I'm not going to bother at all. I just don't see the point.
Well, I know what you mean, but and I have had these issues myself, but I really don't think we can shy away from it.
Okay, see you later.
Thank you. Bye-bye. Hi Sarah, thanks for doing that word round
No
and for
problem.
me being the SHO doing the scribbling. And we might as well make a mini kex out of it.
Yeah, good.
How do you think that went?
I thought it went really well. I managed to find all the findings on the physical examination. I got on with Mum really well, and we identified all the issues and made a good management plan, I thought.
Good for you, good for you. You certainly had a good conversation about the medication, about the epilepsy of Fozia, and gave Mum a lot of insight into these issues. How do you think you could have improved on that?
I'm not sure. I thought I had a really good conversation with Mum. I thought I showed quite a lot of empathy. I thought it went well, didn't you?
I thought it went well, but because it's a mini kex, I'm going to give you some feedback. You had an in-depth conversation about her medication, you discussed side effects, you talked about epilepsy, and it clearly showed your knowledge. I was a little concerned about the possible language barrier between you and Mum and how much she understood, and if she definitely had an opportunity to ask the questions, that maybe concerned her. Then following that, you did an excellent neurological examination and showed me a lot of the abnormalities that are present. But Mum had alluded to the fact that Fozia hadn't woken up for the last 24 hours, and I couldn't really notice you paying attention to her Glasgow coma scale or telling me, what her level of consciousness was. Do you think that's fair?
I'm not sure that is fair. I thought it was clearly down to her medications that she had a reduced level of consciousness, and we looked at her medications really closely.
Of course, that's one of the possible explanations, and she's had extra medication, she's on a lot of medication. But in medicine, I would really like you not to jump to conclusions and to consider a differential diagnosis. Could it be due to non-convulsive status? Could it be due to her very positive fluid balance causing electrolyte abnormalities? Have a differential rather than jumping to one explanation. We then went on to have a good look at her drug chart, and you made some very sensible changes to her medication. But you didn't pay attention to her antibiotic prescribing.
Well, that's not my fault. We decided who was going to do what on ward round this morning, and I delegated that job to the SHO, so that should have been done by her, really.
Okay, let me summarise. You've had showed a good knowledge of epilepsy, of epileptic medication, had a good talk with Mum, but maybe could have considered an interpreter. You had a good clinical exam, showing a lot of features, but possibly could have paid attention to Fozia's level of consciousness. And you looked at the medication on the drug chart, but possibly didn't mention to me what should happen with the antibiotics. Is that a fair assessment?
Well, in all honesty, I don't think this is how I usually perform. I would have got an interpreter had you given me any notice, but you asked to do this mini kex just this morning. I normally look at all the drug charts. I just feel a bit anxious with you looking over my shoulder. This isn't me at all.
I'm sorry you feel that way, and I can understand it's a little bit different from doing your normal word round, but at the same time, this is your normal working pattern, and really the only way to assess it is for me to be present when you do so, and I don't think I need to give you notice for that. But maybe what we can do then is go and see another patient, do another mini kex, and you don't have to feel so unprepared for it. And because I'm your educational supervisor, let's meet and discuss some of these issues.
Okay. Adam, that Dr. Evans has definitely got it in for me. All she does is point out mistake after mistake. I don't know what to do.
Gosh, that sounds so rough. I mean, you're so much more experienced than I am. I wonder what on earth she would say about me if she was watching me do a ward round. Funny thing is, though, she's really nice.
Yeah, she is, until she's your supervisor, and then all she wants to do is point out when you're not doing well, when I think I'm doing fine. I'm really worried that she's going to give me a rubbish trainer's report, actually. I don't know what to do.